katika mahali hapa.
Naam, kwa hivi sasa mtazamaji, tunaarifiwa kwamba Waziri wa Afya Aden Duale anahutubia waandishi wa habari kuhusu maendeleo ya bima ya afya ya SHA katika ofisi za wizara hiyo hapa jijini Nairobi. Hebu tusikilize.
Undermine the public trust in the country's health system and threatens the feasibility and the sustainability of the Social Health Authority. Some of the activities we have flagged or the system the forensic auditors have flagged include: number one, upcoding, deliberately submitting a claim for more expensive procedure than the one which was actually performed. This contravenes clause 16, subclause 1.1 of the SHA contract and section 45 subsection 8 of the Social Health Insurance Act 2023. For example, a facility in Nairobi lodged a claim for a more expensive TURBT procedure which was worth 201,600 shillings, 201,600, after having only performed an open prostatectomy worth 89,600. In essence, claiming more than 112,000 from what was correctly due to that facility. This is a direct depletion of the collective fund that is meant to serve all Kenyans. When fraudulent claims are paid, the pool of resources available for all hard-working and responsible Kenyans is reduced, ultimately jeopardizing the sustainability of our entire system and scheme, and leaving the most vulnerable section of our population exposed when they need the care. Number two, some of the activity that has been flagged off are the falsification of records which are submitted to the Social Health Authority through the Digital Health Agency Superhighway, submitting altered or false information. This contravenes clause 16, subclause 1.8 of the contract, as well as regulation 48, subsection 5, and regulation 34, subsection 2F of the Social Health Insurance Act of 2023. A facility in Bungoma, for example, submitted falsified medical records in support of a claims for a patient who was concurrently admitted in another facility. This is illegal and is punishable under the law. It also leads to exaggeration of claims which adversely impacts on the financial sustainability of the Social Health Authority. The third issue that we have flagged out, or the system has flagged out, both at Social Health Authority and DHA, is the tendency by certain facilities, both government, faith-based, and private, of conversion of outpatients into inpatient. Some hospitals in Nairobi and Homa Bay have been billing for inpatients admission that the patients have since denied ever receiving. And our team have spoken to those patients, and the patients have recorded statements denying that they were inpatients and only they were outpatients. The hospitals have also been converting simple outpatient visits to very comprehensive inpatient care so as to claim more money from SHA. This is an illegality and outright theft, contrary to Regulation 34, subsection 2B of the Social Health Insurance Act of 2023. It also undermines the prudent use of public resources. It further exposes SHA members, as SHA may not be able to pay for its members when its sustainability has been jeopardized through illegal activity. And this is what they have been doing under the defunct NHIF. The fourth issue that the system has flagged is multiple billing and the presence of ghost patients. In some counties such as Mandera, we have established that 4 facilities colluded and lodged claims for a patient admitted in one of the facilities. This was done knowingly and intentionally for the purpose of defrauding the Social Health Authority, contrary to Clause 16, Subclause 1.2 of the contract and Regulation 34, Subsection 2G of the Social Health Insurance Act of 2023. Such kind of collusion is criminal, collusive, and is dishonest in its worst form. It threatens the ability of SHA to pay for genuine claims as the funds are unlawfully depleted. It also endangers the health of our SHA-insured members as benefits of the affected members are unnecessarily depleted. We have found out that this is the same health facilities and many others who are using the multiple billing and ghost patients in the former defunct NHIF. In accordance with the powers conferred by Section 48, subsection 6 of the Social Health Insurance Act, therefore, the Social Health Authority has suspended a total of 40 health facilities found to have engaged in these criminal activities. They have engaged in corruption and they have engaged in the theft of public resources. These suspensions are effective immediately, and we will share with you the Gazette notice signed by the CEO of the Social Health Authority, and of course in the interest of transparency and public accountability, a full list of these suspended health facilities have been duly published in the Kenya Gazette number 168, dated 7th of August 2025. During the period of the investigation, these facilities are not entitled to receive any benefits from the Social Health Authority. Furthermore, we will be surcharging them to recover any monies already paid to them on the basis of these fraudulent claims. Our digital system and the forensic audit further identified several health professionals who have been directly involved in these criminal schemes. These are 8 doctors associated with the facilities in Nairobi, Bungoma, and Kilifi counties. 4 clinicians associated with the facilities in Nairobi and Homa Bay counties. In accordance with Clause 16, Subclause 2.5 of the facility contract, SHA has immediately, from this minute, withdrawn the user rights for these doctors and clinical officers from all the authority and the digital health platforms And we have also informed the regulator, the Kenya Medical Practitioners and Dentists Council, and the Clinical Council of Kenya, to implement the decision that we have made today. As far as the facilities, the 40 facilities are concerned, as far as the 8 doctors are concerned, and as far as the 4 clinicians are concerned, in as far as the period they are under suspension and the period in which they are under investigation. And I want to remind our able healthcare providers that you owe your clients a duty of care, as no medical procedure can be performed and paid for by SHA unless the relevant health care professional receives an one-time password, which is known as OTP, authorizing that procedure. Therefore, any healthcare provider whose information is used to defraud SHA shall be held personally liable, as is the case for the 8 doctors and the 4 clinicians. It is also criminal for any healthcare professional to induce provision of service with the intent of defrauding the Social Health Authority. The Ministry of Health shall forward the list of the suspended health facilities and the toll of healthcare professionals implicated in the criminal acts to the Director of Criminal Investigation, so that they shall face the full force of law. We have also notified the Kenya Medical Practitioners and Dentists Council and the Clinical Officers Council to initiate immediate disciplinary action against the 12 healthcare professionals, which will lead to their cancellation of their professional licenses. Further, the 40 facilities, outside the 40 facilities, the facilities that were recently suspended and downgraded by the Kenya Medical Practitioners and Dentists Council shall not have their suspension lifted until they comply with the corrective actions issued by the regulators. And I want to make it very clear to our leaders, to the many people who come to the Social Health Authority offices, to the many people who come to my office, or to the PS, or to DHA, or to the regulators' offices, you're wasting your time. We are telling you, comply with what you have been told, comply and make the corrective actions which have been issued by the regulators, then we can consider lifting the suspension for you to do genuine, honest business. The ministry under my leadership remains steadfast in the resolve to protect our social health insurance scheme and to ensure that every cent contributed by Kenyans is used to provide legitimate, quality health care to our citizens. The update we are providing today is to ensure public awareness of our enforcement actions and demonstrate our unwavering commitment to protecting public resources and the interests of our hard-working and responsible members who are faithfully paid for their cover. I call upon all Kenyans to support us as we seek to protect our social health insurer from fraudulent activities. Let us exercise caution and be vigilant with our personal data and not share the SHA one-time passwords or identification details with anyone. And I really want to speak to the citizens. Don't share your SHA details with facilities or people who want to defraud and do fraudulent activities with your insurance policy scheme. They did it under NHIF, and I want to tell them today, in a broad daylight, you cannot do that business again. If you made money under NHIF, you better go and look for another business. You will not do those kind of things you used to do under NHIF, because the moment you try, we will know from all our dashboards and our system and our forensic auditors will be at your doorstep. The sharing of OTPs is particularly a problem we have seen at level 2 and level 3 facilities, and it's being used to perpetuate fraud. And this is why we roll out the biometric system at level 4, 5, and 6 facilities to curb this practice. Soon we will be rolling out at level 2 and 3 facilities, where you share your OTP and the same is used to defraud Social Health Authority. You will also be held liable as a patient and be charged in the spirit of collective and social responsibility. Social accountability, sorry, in the spirit of collective and social accountability. And we are speaking to our patients. There are patients who have come out, they have recorded statements, but there are patients who are being used by...
Naam, Sadakta mtazamaji, amekuwa ni waziri wa afya Aden Duale, ambapo ameweza kusema kwamba kwa hivi sasa ni kwamba takriban vituo 40 vimeweza kusimamishwa kwa muda kutokana na ubadhirifu na udanganyifu dhidi ya madai ya uongo ya bima ya SHA, na vile vile amesema kwamba serikali itaweza kuchukua hatua ya kudai fedha hizo kutoka kwa vituo hivyo. Na wakati huo huo ameweza kuwasimamisha madaktari, ama ameweza kusema kwamba madaktari 8 kutoka kaunti ya Nairobi, Bungoma, Kilifi na maafisa wa kliniki wengine 4 watakabidhiwa kwa idara ya ujasusi kwa uchunguzi zaidi, huku akisisitiza kwamba wizi unaendelea kupitia hospitali mbalimbali kwa kutumia kigezo cha bima ya afya ya SHA, na hivyo basi ni kwamba hospitali nyingi zinatoa bili zaidi ya ile ambao mgonjwa ameweza kuambiwa, na wagonjwa hewa pia wameonekana huko Mandera, na vituo 4 pia vimeweza kupatikana na hatua hiyo katika kaunti ya Mandera. Mtazamaji, ni taarifa ambayo tunaifuatilia kwa kina. Mengi zaidi ni baada ya muda usiokuwa mrefu.